first, our top story at 5:30. While we're already worried about contagious subvariants of Omicron, now there is another extremely infectious mutation to add to the list. The BA.2.75 strain has been confirmed now in California. Good evening, I'm Sarah Donchi.
And I'm Ryan Yamamoto. That BA.2.75 subvariant has actually been in the Bay Area since last month. Here's what we know. Cases have been identified in at least 12 countries, including India, where it's now driving a surge. 2 cases have been confirmed in California. They were picked up in Bay Area wastewater samples from mid-June. The World Health Organization has identified it as a variant of concern and is keeping a very close eye on its mutations.
So this comes as California's COVID positivity rate has gone up to 16.7%. That is up more than 2% from last week, continuing the trend. The more concerning number, hospitalizations in California and the Bay Area have reached their highest point since February when we were coming out of the Omicron surge. But for perspective, it is still far below any previous surge.
So here to break it all down, Dr. Peter Chin Hong, a UCSF infectious disease specialist. So thanks for joining us. So let's start with this new variant, BA.2.75. So how does this compare to other contagious variants that we've been talking about, like BA.5, BA.4? What do we know about how good it is at getting around our immunity?
Well, we don't know a lot so far, Ryan, but what we do know so far is a little bit worrisome. It's small numbers, but so far in India, it's about double the rate of increase as BA.5. They saw this surge in some states in India. They thought it was all going to be BA.5. And lo and behold, it was something new. It was BA.2.75. We don't know if that doubling would hold out in a bigger sample, but it is something to look out for. But it also reminds me of the conversation around Lambda and Mu and some of these other scary looking variants that were more regional. And we never know what will happen on the playing field of life until BA.5 comes neck and neck with BA.2.75.
So it's never good to see hospitalizations rising, of course, because that is a person with a family every single time. But Dr. Chin Hong, you're really good at putting things into perspective for us. The majority of these infections from these subvariants, you say, are milder. And what do you make of the hospitalizations rising?
So I think hospitalizations are a tough number to put your head around because they reflect people who are also diagnosed with COVID because they were screened, as opposed to people who are really sick. Nevertheless, they do give us a good metric overall. But to put things in perspective, at UCSF today in 4 hospitals, we have a total of 45 patients. But again, it really pales in comparison to even January, where we had 150. And of those 45, only 1 patient is ventilated. If it was January, we'd probably have 12 or 20 people in the ICU on mechanical ventilation. So we're seeing hospitalizations, but they look a little bit different so far, knock on wood. They're shorter stays, they're not in the ICU. And it also reflects the fact that many of the people in the Bay Area are vaccinated and boosted. The people who are vaccinated and going to the hospital are mainly those who are unboosted. So if there's one takeaway point, is please go and get your booster shot.
And a lot of people, they're just tired of taking precautions. They want to be able to live their lives and travel. So do you see this surge letting up anytime soon? And what's your advice for people who just want to go out this summer and still be safe?
I say go out with enthusiasm, go out with gusto. We have a lot of tools. Use those tools wisely. If you're traveling domestically, for example, figure out who can prescribe you Paxlovid if you go across the country. Where are you going to get it? Do you have drug interactions? Do your homework before. I always carry around my mask anywhere, put it on anytime I feel risky. And of course, I had an event, a wedding to go to over the weekend. It was outdoors, but the host wanted us all to be tested beforehand. So again, these kinds of layers of protection, they're not foolproof, but together they add up. And I guess we can't only rely on vaccinations.
I know you encourage people to get vaccinated all the time, but I want to ask you, how are the vaccines standing up to some of these new variants? And are they going to be tweaked the way we see perhaps a flu vaccine evolve over seasons? And should people still get the current booster, even if it may not be performing as well as scientists had hoped?
Yes, the answer is yes to all of the above, Sarah. And let me explain. So as an infectious disease doctor, I'm really excited for the power of vaccines in preventing hospitalizations, because look at outside, it's like full of fire of COVID. And in the old days, before vaccinations, we would be flooded in the hospital. Right now, we're still kind of holding our own, like we mentioned. So the vaccines do work. We don't know when the updated booster will be available, end of October, early November. So go ahead and get that booster. We know that boosters save lives right now, and not to wait, but the vaccine really needs to be updated to prevent the other outcome, which is infections, because infections cause a lot of disruptions. It's still no walk in the park to get a reinfection or an infection for the first time, and I wouldn't wish it on anyone.
Mm-hmm.
Always some good information. Thank you once again for breaking this all down, giving us some insight. Dr. Peter Chin Hong, thank you very much.